asking families, I guess, what they need might be one way people could do that, to just ask them, what would you need to be able to sit at the table, right?
Absolutely, absolutely. And when we talked about training and preparation for these meetings, something that we've worked really hard on has been doing things at different levels. Because parents are at different levels and different stages also. And like you just mentioned, I guess that's what put the light bulb in my head, was that we have a lot of families who struggle as far as literacy. And so to sit at a meeting and everything be written down is really complicated when you don't know what's down there, you know. But we want to participate, and we have a huge story to tell and a lot of good information to share with the system leaders. But if we're not able to read and write, we still need to be part of that. And so that's part of our training, is kind of making sure that parents feel comfortable to sit at the table, no matter what level or no matter where they are stage-wise in their journey with their children. You know, we have parents who are just beginning with the small children and the babies, and then we have families who are, you know, transitioning into adult services. So there's all different levels, and we've really got to be mindful of that. And with building partnerships as well, we have to be mindful of that, you know, that we have families who are very capable and want to be able to share their stories. But we have to make sure that they're in the spot where they can best put this information out and really feel comfortable of being partners.
Right. It's real hard to talk about partnerships without both a professional and a family member in the room talking about it together, because it's one thing for Kim and I to have some ideas about partnerships, but the professionals that we work with are the other half, and so it's important that we hear from you too. I thought maybe knowing the values that your organization in Detroit holds about families, what do you see as the barriers to these partnerships?
Leaders just don't think about it. I don't think it just easily occurs to them that, because we're in we've been for so long in a society where people are told, given information, and then that's it. You take the information, you don't have a dialogue. I mean, we see that in our medical care, where the doctor used to say, well, this is what I'm prescribing, and you never ask the question. So I think it's not, unfortunately, a natural occurrence to think about the importance of having families equal at the table, not just sitting at the table, but equal at the table. So I think it's an orientation. I think it's an expectation. I think you have to have an advocate. I think you have to model it. I think you have to be consistent with it across everything you do. And I know that most counties are involved in this process and are doing it. I think this, you know, when you talk about the leadership, I think that once they get it, it works. And it's like a no-brainer. Why didn't we do this before? But I think you do have to do all the things I just said to lead up to that awareness, so to speak, that, you know, parents have something to contribute, family members have something to contribute, youth have something to contribute, young kids have something to contribute.
Right. Besides just not knowing, do you see other barriers in the way, lack of information, lack of training? I mean, are there some other barriers that you think also contribute to, you know, people not doing work in a partnership way?
I think often people feel threatened, and I can't begin to describe why. Maybe challenged. I'm a professional. I trained to do this. You're coming to me for help, so how can you provide any assistance in this endeavor? Any
solutions?
Well, I do remember a meeting that we had of a group of CEOs and other administrators in our service provider network and our community mental health network. And we had one provider from Southwest, John Van Camp, and he talked so eloquently about how positive it was to have families at the table, how much he learned personally, and how much it had affected his agency and how he did business. And so I think that's important to have a provider talk to other providers, to have the CEO of a very large community mental health agency, and a very diverse agency that sees a diversity of clients, talk to his fellow CEOs, his fellow executive directors.
That's very helpful. I also had heard you say something earlier about that kind of translated for me into family blame, and that's sometimes a barrier, is that families, I think, are blamed for their child's, and not their child's behavior issues or their mental health challenges. And I think that gets in the way sometimes of being able to create the partnership. Would you agree to that? That at the provider level,
well, yeah,
that can
I
be
think
difficult
I
at
think they're
times?
blamed. I think they're often blamed, or they feel blamed.
Yes.
Yes. They experience it very negatively, having to come to treatment, and so I think, and so parents often come angry.
Right.
They've been sent.
Yes.
And none of us like to be sent anywhere. So I think it's a combination of feeling blame, having been told that they have to bring their child for treatment because something's wrong, and often not feeling heard about their opinions about what's going on. But often, in all honesty, families are also on the defensive.
Right.
So that's why, I mean, I'm talking about, at the same time, you have to empower parents to be comfortable. They can tell their story, but also they're comfortable enough to say where they were at the time they sought treatment, because I think that's as important.